Hi, I'm Dr. Akshay Kothari, MD Physician at Radiant Hospital. So today we'll be talking about a very important topic, that is asthma, also known as bronchial asthma, and in some patients COPD, chronic obstructive pulmonary disease. So what are the symptoms of COPD? So first of all, if you have symptoms like chronic cough, breathlessness, recurrent fever spells, if you have chest heaviness, if you are very fatigued after climbing one flight of stairs, so you may have what is called as COPD, chronic obstructive pulmonary disease. If these symptoms you have, you need to test for few things. First of all, you will need to do an X-ray and a PFT, pulmonary function test. So pulmonary function test will tell how your lungs work, how your lung capacities are, and after giving some medicines or bronchodilators, how they have an effect on your lungs and improves your PFT levels. So once this is done and you are diagnosed with COPD, it is very prudent and important to take the treatment for chronic obstructive pulmonary disease. So usually you will be advised with bronchodilator pumps or even respules with nebulization, which are available, and also some medicines for treating this COPD. So it is very important to get your health checked if you have such symptoms, because these exacerbations can be very severe and can land up some patient in ICU also. So it is better to get investigated quickly. You can come to Radiant Hospital where we evaluate these symptoms and advise you according to the symptoms you have and the test needed. Thank you.